Hi, welcome to Doc Talk. As you remember, Doc Talk is the Knoxville Academy of Medicine podcast where we talk about health issues affecting all East Tennesseans in plain language. Today I have the distinct pleasure and opportunity to welcome to Doc Talks Dr. Bob Overholt. He needs no introduction. He is one of the former presidents of the Knoxville Academy of Medicine. He has cured sinus and allergy for most probably, I would say, every East Tennessean out here. He started our flu shot program. He has his own Dr. Bob show. I mean, I'm just so privileged that you are here with us today.
Elise, it's a pleasure and honor being here with you. You're a great educator and a great teacher, and it will be fun being on the Knoxville Academy of Medicine podcast.
Thank you. So we're going to talk about allergies today in its broadest spectrum. Let's just start from basic.
Allergies are a huge, huge problem in the United States and in the world. Allergies are on the increase. It used to be, when I came into practice in 1970, 20% of the population was allergic, and they would have problems like hay fever, asthma, sinus disease, some allergic skin problems. And then all of a sudden it was 30%. And now it's 40% in the United States of people have allergies. So 4 out of 10 will have allergies. In Europe, it's 50%. So more than half the population in Europe has underlying allergies. Why is that? And what are allergies? Well, we've got an immune system, and the purpose of the immune system is to protect us so that if we're exposed to bacteria or viruses or we cut ourselves, the immune system will come in and it will help us survive those episodes. So the immune system will neutralize bacterial infections, it will kill viruses, it will support us when we have some type of illness. So something is making the allergic immune system more and more active. And we've wondered what that is. And we feel like most likely it's one of two hypotheses right now of why more people are becoming allergic. Number one is pollution. There's no question that in the world we've got more pollution. We've got global warming. The pollution is predominantly ozone and carbon dioxide, some acidic materials. And with the pollution, when people are breathing that in, the immune system tries to protect itself from new exposures from the pollution. So when that happens, sometimes the immune system is not needed because there's no pure protein antigens, is what we would call them. And so people begin to develop allergies. The immune system starts developing allergic responses rather than protective responses. And so more and more people are becoming allergic. The other hypothesis is called the hygiene theory. And that's in the United States. We wash our hands frequently. We keep things super clean. We treat with antibiotics quickly, sometimes too quickly. So what we do, we're taking the responsibility of the immune system away, because if we wash our hands, we're washing it free of bacteria and washing it free of viruses, washing free of things that we're exposed to. So if so, the immune system is not challenged like it normally would be. And so the immune system then is tricked into developing allergic reactions to certain things. So that's why.
It is, you're so right. It is so hard to know as a mom. It's so hard to know, okay, my baby's, do we still call them pacifiers?
They're still pacifiers.
It falls on the ground. Do I pick it up and put it back into Junior's mouth knowing that he's going to have a tough immune system and it's not going to hurt him? Or do I be very fastidious and wash it off and get it absolutely, sterilize it before I put it back in his mouth? And that's a very hard thing.
It is. There's some interesting studies showing that children that grow up where there are dogs in the house that are inside. And dogs sometimes with their tongues are not the cleanest people in the world, but the dog licks the baby's face and they lick his paws and may lick the rest of his body type situation. So what they found is and children's immune system, that where there is a dog in the house, will be more protective and will be stronger. It'll be a better immune system than right down the street where there were the next house over, where there were no pets inside the house. So there's something that a dog might begin to transfer that helps the immune system, whether or not that's bacteria, whether we know now, we talk about the word microbiome, and we know now that the body has trillions of bacteria. Well, if you'd have told me 20 years ago we had trillions of bacteria, I'd say, oh, there's no way, the body can't handle all that. But that's part of the immune system's protecting us. So there's the microbiome of the gut that protects the sinuses and protects the rest of the body. And so it's a fabulous thing. What I get out of this is we learn every day. And we think we're getting pretty smart now. 10 years from now, we'll realize how stupid we are today. And now we realize how stupid we were 10 years ago. So we've got a lot to learn to help people, to help cure illnesses, to make people have a happier and healthier life.
And it's not easy. And we do have to be careful about not letting our arrogance or our belief that we know gets in the way. And you know what's so interesting about the human body and allergies is that because I'm ear, nose, and throat, I deal with ear, noses, and throat. But allergy, it really doesn't discriminate to one organ system. It impacts your eyes as well as your legs, as well as your skin, as well as everything.
It really, really does. And when we think of allergies and when we think of ear, nose, and throat, when we think of the nose, we think of allergic rhinitis. That's an allergic nose. Some people call it hay fever if you have problems in the spring and the fall. It's not due to hay and there's no fever, but it is an allergic reaction. So we find people in the spring of the year that tree pollen, and pollen, every tree has a flower. And the flowers, some of the flowers will have pollen. They're the ones that don't have the attractive flowers. The bees will pollinate the attractive, fragrant flowers from the tree. But the other tree pollen, the pollen floats around in the air, and when we breathe in the pollen, then the pollen is grabbed up by what we call certain cells that will take it to the immune system to try and get rid of it, because the pollen is a foreign substance. But in some people, they seem to be predisposed to develop allergies. And so with that, they'll develop an allergy antibody specific to a specific tree pollen. And that happens inside the nose. When that happens the next year, when that same tree pollinates, you get the allergic reaction with hay fever. And the hay fever is stuffy nose, runny nose, sneezing, itchy eyes. And it makes people miserable. And it will dominate their life. It really, really will. And sometimes, when people have nasal congestion and a stopped up nose, they can't enjoy food, they can't sleep well, they can't think well, they can't perform well. So it's not just simply a runny nose. It really involves, and the allergic reaction releases some chemicals that make people feel poorly. And so they have, I call it Alka-Seltzer blahs, too poop to pop, just because of the allergic reaction. So we've got tree pollen that's March, April, May in East Tennessee, and then we've got the grass pollen that comes in April, May, June, and both of those put a huge load on the immune system to try and protect the body. And if the person is allergic, then they're in big trouble, because they're going to have trouble. There's very little you can do to avoid pollen.
I know.
Yes.
I know. It's everywhere. I said, you can't avoid not going outside. How is that going to affect your quality of life? You have to be outside watching your grandson play his baseball game.
That's right. What would life be like?
It wouldn't be the same. So when we have people who have chronic runny noses, I sometimes tell them, when you have an allergic response, it doesn't require, because you mentioned too many antibiotics too early.
Yes.
So antibiotics really don't help a runny nose if it's not because it's a bacterial infection.
Well, and we feel like most people that have a sinus infection, runny nose with maybe discolored nasal exudate, that we We feel that most sinus infections are what we call self-limited. The body will take care of it, and so we don't need antibiotics for most sinus infections. Now, from an allergic standpoint, the lining of the nose is abnormal and sensitive anyway, and so it's more responsive to infection than somebody's nose that's not allergic. And so sometimes it's harder to get rid of infection if there's underlying allergy, but still, we can use saline irrigation, we can use decongestants, and frequently we can avoid antibiotics, which will eventually cause trouble if we are not careful in the United States.
So I have a question.
I got an answer. I think
One of the moms asked me one time, if I don't use an antibiotic, does that help me or my child, who would have an infection, build a stronger immunity?
That's a great question. So does overuse of antibiotics make a weak immunity? Or if you refrain from taking an antibiotic, does that strengthen your immune system? I like to look at the bacteria as what's in the community. So if you've got a specific type of strep bacteria, and we treat everybody that's got a strep infection, well, then the strep bacteria will become better than the antibiotics, and so our immune system won't be able to handle it later on. So it's a good thing to try and avoid the community of strep. For the individual person, there's another question. If just Dr. Overholt, if I just use an antibiotic every time I get an infection, well, that means eventually the antibiotics will quit working or not. Well, there's no question that Dr. Overholt, carries a immune system in himself with bacteria that are there. And so just the stronger ones are the ones that survive. It's Darwinian theory. And so it may be that eventually antibiotics that used to help with a bacterial infection, for me, not going to help me or my neighbors.
Good to know. So I've got another question that kind of get fielded in the crossroads of life. They're not sure how allergic they are, but they do know if they get exposed to something, they have a violent reaction. They get very tired, and either their nose runs, or they get diarrhea, or sometimes a food allergy, and they want me to write a prescription for an EpiPen. I'm happy to do so, but sometimes I need to caution them that the likelihood of having an anaphylactic reaction is not as strong. The worry that comes along with it, I think.
So people that have a reaction of some kind to a foreign substance very rarely have true anaphylaxis. And anaphylaxis is a severe, potentially life-threatening reaction where an allergy reaction, like to a bee sting or like to peanuts, where somebody gets some swelling of the lips, and then the lip will swell, then the throat swells, then they break out in hives all over, then they can get short of breath, and the chest gets tight and they begin to wheeze, and then the blood pressure can fall and they don't have a blood pressure. That's a severe reaction. Those people need to have an EpiPen available. So the doctor and the patient has to make a decision as to whether they're prone to having an anaphylactic reaction. And there's certain people that are, certainly with bee stings and certain foods, it puts them in that category. A nice sideline of this is, in playgrounds, if somebody might be stung by a bee and they may be allergic to bees, or somebody may somehow inadvertently give them a cookie with a peanut in it, there's a Good Samaritan law in the state of Tennessee that allows teachers to make a decision if somebody is having an anaphylactic reaction or they think they are, that they can go ahead and self-administer adrenaline, and they're not responsible for any side effects of that unless they gave the adrenaline with intent to harm somebody. Well, nobody would do that.
Right.
So with that in mind, we've got a lot of good laws that will protect people from allergic reactions. We've also got good doctors in a way that we can identify the people that are having problems. So we've got allergy skin testing and blood work that will detect whether somebody has certain types of allergies to foods or to bees, and then we can protect them. We can desensitize to the bees and make it where they're resistant to a sting. And now we're beginning early to understand that we might be able to, and I use those words very carefully, help people tolerate certain foods that they have reactions to. So, for instance, peanuts. It may just take a tenth of a peanut to have a severe allergic reaction.
Right.
Well, now we're developing what we call immunotherapy, where we can expose people to small amounts of peanut, increase it to where if they make a mistake and may eat 2 peanuts, that they'll be able to tolerate that. We don't have anything yet that says we can get rid of your peanut allergy. We're not that good yet, but we may be. You know, there's no reason to suspect that we can't do that.
That's good to know, because some people, they always want to know, once identified having an allergy, on that spectrum of severity, is my allergy mild or is it severe, which requires testing? And then does that level of severity change over time? 10 years ago, not as allergic, now maybe more allergic. So it does require testing.
Yes, and I look at everybody as every human is different. There's no one patient that's like the other patient. So everybody's an individual, and they've got their individual sensitivities to the allergic reaction that they have. It's different than somebody else. Mom and dad may have allergic reactions to tree pollen in the spring, but their children may have lung reactions to pollen in the fall, or to dust, or to mold. And so the propensity to develop allergies is passed down. There's a familial predisposition to develop allergies if the parents are allergic. But the specific allergy is not necessarily passed down from the parents to the children. So mom may have food allergies, and children may have pollen allergies, and their children may develop atopic dermatitis, eczema, a type of skin allergy problem that people have. So we're going to have to get smarter and figure out how that we can keep people from becoming allergic. And there's no reason we can't do that. That's if there's a genetic predisposition. We're getting smart enough now where we can begin to manipulate the genomes, the genetics that people have, to make it where they'll be healthier people. And that's what I'm looking for in the advances in medicine in the future.
I know, it's exciting, isn't it?
You know, it's just terribly exciting because there's so much, the information, it's an information overload. There's so much going on now. And it's there to help other people, and that's what's good about it.
Yes, that new information is not to cause fear, but to improve health for everybody.
Yeah.
It's very exciting.
It doesn't make it a good world when we're, healthier and happier and don't have illnesses.
And don't have illnesses. Well, we really only just scratched the very surface of allergies, and I'm sorry if I might have gotten sidetracked, because maybe a future podcast will talk about allergies as they affect our gut and as they affect our skin and so on and so forth. But if people have more questions and they wish to come and have skin testing, and just questions of, am I allergic to this? Where do they find you?
Well,
or where do they not find you?
you can always call the Knoxville Academy of Medicine, and
Yes.
they'll have a list of allergists that are in the community that are trained to diagnose allergic disease. So the allergists are trained, and primary care physicians can do skin testing. So they're trained to do allergy testing for pollen, for dust, for mold, for animal dander, for foods. And so the testing is available to help diagnose for the patient so that they can develop a plan. And the first plan we always want is avoidance, but you can't avoid certain things. And so then we have to utilize medications to help the nose if it's the allergic reaction is in the nose, or asthma medicines if it's in the lungs. So then we have the treatment program, and then we're getting to where if we can develop immunotherapy to help develop tolerance, or we can get these diseases to go away. That's the ideal thing.
Thank you. Thank you so much. Such a pleasure to chat with you today about allergies, and we'll look forward to the next version.
It's been exciting for me to come here and to be on the podcast here, and we'll have to do it again because you're right, we just barely touched things.
We really did. So thank you for joining us today to talk with Dr. Bob Overholt of Allergy, Asthma, and Sinus Centers about just scratching the surface of allergies and how our body reacts to allergies and how to take care of them so that we can go on enjoying life and contributing to the community. And so thank you again for joining us, and that's a wrap.